Imagine you're working as a medical biller. A doctor hands you today's patient notes. You look down and read, "Patient presents with HTN." You freeze. What does HTN mean? Can you submit a medical aid claim if you don't understand what the doctor has written? Probably not. The truth is, medical billers don't need to become doctors, but they do need to understand the language doctors use every day, and that's exactly what you're going to learn today. Do medical billers need to diagnose patients? No, they simply need to understand common medical terminology so they can support accurate billing. Medical terminology is the common language used by healthcare professionals. It helps everyone communicate accurately across the entire medical chain. Without it, claims become inaccurate, coding errors increase, and professional communication suffers. Ultimately, it leads to delayed payments. Imagine a doctor writes the word hypertension in the patient's record. The medical biller understands this immediately as high blood pressure. Because they speak the same language, the claim is processed correctly the first time. Let's test your knowledge. What does the term hypertension mean? That's right, it means high blood pressure. Understanding these terms is your superpower in medical billing. To bill accurately, you need to understand where the treatment is happening. Let's explore the major systems of the human body. First, the circulatory system. The heart is the engine here, pumping life-sustaining blood to every corner of the body. Then we have the respiratory system. If a patient is struggling to breathe, this is the system doctors are focused on. From the digestive system that processes fuel to the nervous system that controls everything. Every organ has a specific place in medical coding. Quick check. Which organ is responsible for pumping blood throughout the body? Correct, it's the heart. Understanding these systems helps you categorize treatments and codes with precision. Medical words might look long and scary, but they are just like Lego blocks. They are built using prefixes, roots, and suffixes. Take hyper and hypo. Hyper means too much, like hypertension, high blood pressure. Hypo means too little, like hypoglycemia, low blood sugar. Then we have brady for slow and tachy for fast. Understanding these small parts helps you decode the entire diagnosis. Suffixes at the end tell you what's happening. Itis means inflammation, and ectomy means the surgical removal of something. Time for a quick challenge. Based on what we just learned, what does the term arthritis mean? Correct, it's joint inflammation. Once you know these building blocks, you can read almost any medical note with confidence. Now let's look at some of the most common conditions you'll see every day in patient records, from high blood pressure and diabetes to respiratory issues like asthma and pneumonia. These are the heart of medical billing work. We also encounter chronic conditions like arthritis and migraines. Your job is to recognize these terms accurately to support the claim. Take Mrs. Smith's visit. Her doctor records a diagnosis of diabetes in her file. The medical biller recognizes the condition immediately, ensuring the correct codes are applied and a clean claim is submitted. Quick quiz. Which of these common conditions is known for affecting blood sugar levels? It's diabetes. Recognizing these conditions is the first step toward becoming an expert medical biller. In medical billing, you'll work with many different doctors. Let's meet the specialists who provide expert care. First, we have cardiologists for the heart, neurologists for the brain and nervous system, and dermatologists for skin conditions. Then, there are orthopedic surgeons for bones, pediatricians for children, and psychiatrists for mental health support. Test your memory. Which specialist is responsible for treating heart-related conditions? And who treats our youngest patients? That's right, their pediatrician. Recognizing these roles ensures that you route claims and codes to the right place every single time. You don't need to understand every sentence in a medical record. You only need to identify the key details that drive the claim. Look at this consultation note. It contains patient symptoms like cough and fever, but as a biller, your focus is elsewhere. Your job is to identify the diagnosis, the treatment, the date of service, and the specific procedure performed. Let's try an exercise. Take another look at this note. Can you identify where the doctor has written the diagnosis? There it is! Identifying these core elements quickly and accurately is what makes a professional medical biller successful. Now, let's talk about the foundation of every clean claim. Clinical documentation. In our world, accuracy is everything. The patient file is more than just a record of a visit. It is the legal evidence required to justify the services provided. Thorough documentation supports accurate coding, protects the practice during audits, and ensures timely payment from medical aids. Poor documentation leads to queries and rejections. Good documentation provides a clear, billable story of the patient's care. Here is the golden rule. If it wasn't documented, can it be billed? Usually the answer is no. Remember, if it wasn't documented, it wasn't done. Documentation is your best friend. Doctors love shorthand. To work efficiently, you need to speak their code. Let's break down the most common abbreviations. First, the basics. BP for blood pressure, HR for heart rate, and the all-important DX, which stands for diagnosis. Then we have RX for prescription, TX for treatment, and as we've seen, HTN for hypertension. Finally, look out for DM for diabetes, URI for infections, and SOB, which simply means shortness of breath. Quick check. When you see BP in a clinical note, what does it mean? That's right, it's blood pressure. Master these codes and you'll navigate medical records like a seasoned professional. Let's put everything you've learned into practice with a real-world case study. This is where it all comes together. Our patient is a 65-year-old male presenting with chest pain and a known history of HTN hypertension. Here is your challenge. Identify the condition, the primary body system involved, and the required treatment mentioned in the notes. The doctor has prescribed medication and scheduled a follow-up in 2 weeks. Take a moment to think about your answers. The condition is HTN, the system is circulatory, and the treatment is medication. If you got those right, you're thinking like a professional biller. Great work! You've successfully applied your knowledge to a clinical scenario. You're ready for the final step. Today, we've covered the essentials: medical terminology, body systems, common conditions, specialists, reading clinical notes, the rules of documentation, and those vital abbreviations. Congratulations! Today, you've taken one of the biggest steps towards becoming a professional medical biller. Remember, you don't need to become a doctor. You simply need to understand the language doctors use every day. The more familiar you become with medical terminology, the more confident you'll be when reading records, communicating with professionals, and supporting accurate claims. In the next module, we'll take everything you've learned and begin working with ICD-10 diagnosis codes, one of the most valuable skills in medical billing. Subscribe for practical medical practice management guidance with Simply Motsoka. I'll see you in the next lesson.